Welcome to MOH Essentials, indications for compression treatment in acute venous diseases and post-thrombotic syndrome. These recommendations are based on recent guidelines and our consensus document. In deep venous thrombosis, we recommend the immediate use of compression to reduce pain and swelling, thereby allowing instant mobilization in acute DVT. The compression should be used immediately after the diagnosis of DVT. We recommend the use of early compression and mobilization in addition to anticoagulation to avoid thrombus propagation in acute DVT. We also recommend the use of compression treatment for the treatment of symptomatic post-thrombotic syndrome. In the ESVS guidelines, the compression treatment is also indicated for the immediate treatment of deep venous thrombosis in addition to anticoagulation with a compression pressure of 30 to 40 millimeters Hg in the ankle region. Compression treatment is also indicated for the prevention of post-thrombotic syndrome after deep venous thrombosis. This recommendation is based on a study by Amin and co-workers who could show in a comparative study with no compression and medical compression that with compression there are significantly less objective Villalta score parameters like pain, induration, and pigmentation with compression after 3 months compared to no compression. The ESVS guideline also states that the duration of compression should be tailored individually and may be limited to 6 or 12 months. This is also based on a study by Tenkate, who could show that in those patients who have no post-thrombotic symptoms after 6 months and 12 months, compression treatment can be stopped, whereas those patients who have still post-thrombotic symptoms like feeling of swelling, like skin changes, after 6 months and 12 months, compression has to go on. As after deep venous thrombosis, we recommend compression treatment also after superficial venous thrombosis, in addition to other therapies like anticoagulation. In the IDEAL study, Arina Tenkate from Maastricht compared individualized compression after deep venous thrombosis with standard duration of elastic compression therapy for 2 years. And she could show that after 6 months, a number of patients could stop compression therapy because they had no further symptoms of post-thrombotic syndrome. And by this individual tailoring, over 50% of the patients stopped compression therapy at 6 months, and another 10% stopped compression after 12 months, and the remaining 40% had long-lasting compression treatment after deep venous thrombosis. Thank you very much for listening.